was born in Colombia, South America, and my parents moved to Florida when I was 5 years old, and I was raised in Florida. I went to med school at Florida State and undergrad as well. And for my general surgery residency, I spent 6 years at Virginia Tech Carilion Clinic, where I also trained in robotics at the time. My mother was a surgical technologist growing up, and she used to bring home videos of surgeries. And since the time I think I was 5 years old, I was always fascinated with the human body from the videos she used to bring home, and specifically surgery. The reason we would fix a hernia, or we recommend surgical repair of a hernia, is if the hernia is causing you any symptoms. So if you're having pain from your hernia, it's a very good time to get it fixed before it does become a medical emergency. So robotic surgery allows us to do the laparoscopic procedure. The specific two benefits for hernia repairs with robotics are you can reconstruct the abdominal wall, which is the standard of care. A lot of the times when people are doing laparoscopic repairs, they don't close that hole. They just patch the hole with a mesh. Patient satisfaction is not as great as if you close the hole first, put the belly muscles back together in the middle, and then put the mesh up. The second benefit is the mesh, the second layer of reinforcement. We can suture it up with the robot. You're suturing upside down, which is very easy with the robot and very difficult laparoscopically. So the suturing of the mesh allows us to have a better recovery and decreased postoperative pain.